Adult CPR. Adult CPR steps. Always observe universal precautions when rendering first aid care. Proper recommended protection for CPR consists of protective gloves and a breathing barrier. It is very important to protect yourself first. The 3 C's of CPR: check, call, care. Check the scene. Make sure the scene is safe before proceeding. You do not want to become the second victim. If the scene is unsafe or becomes unsafe at any time, do not proceed. Check for injuries. Is the body disfigured? Bleeding? Check for consciousness. Tap the victim on the shoulder and shout, "Are you okay? Are you okay? Are you okay?" Get help. Yell and shout for help. If someone is near, point to that person and have them immediately call 911. You call 911. If you are alone with an adult, call 911 immediately. If you must leave the individual to call, place them in a recovery position. Begin CPR using the new CABD method. Compressions, airway, breathing, defibrillation. Compressions. Proper placement for chest compressions on an adult victim is the center of the sternum. When giving chest compressions, you are pressing with the heel of your hand. You can interlace your fingers or place one hand on top of the other. You want to be directly over the victim with your arms locked out. When you press down, you want to press hard enough to make the sternum fall at least 2 inches in depth. Once you press down on the sternum, let the chest recoil completely before the next compression. Deliver 30 chest compressions at a rate of at least 100 per minute. Use the heel of your hand to perform the chest compression. You can place one hand on top of the other or interlace your fingers. Lock out your arms directly over the individual. Do 30 chest compressions at a rate of at least 100 per minute. Compression depth is at least 2 inches in depth. Airway. Open victim's airway with the head tilt, chin lift method. Place one hand on the victim's forehead and the other hand under the victim's chin. While gently pressing down on the victim's forehead, lift up on the chin. Breathing. Pinch the victim's nose with the hand that's on the forehead. Deliver 2 rescue breaths to the victim. Once the chest rises, stop giving the rescue breath and let it fall. Once it falls, give another breath. Every individual will require a different amount of oxygen. Just make sure the chest rises and falls, rises and falls. Continue to give 30 chest compressions and 2 rescue breaths until help arrives, the victim shows signs of life, or an AED arrives on the scene. Defibrillation. Automated External Defibrillator, AED. Turn AED on and follow the voice prompts. Let's review. Check the scene. Make sure the scene is safe before proceeding. Check for consciousness. Tap the victim on the shoulder and shout, "Are you okay?" Make noise. No response? Point to a bystander and get the bystander to call 911. Immediately begin CPR using the CABD method. Chest compressions. Using the heel of your hand, immediately begin doing 30 chest compressions at a rate of at least 100 per minute with a depth of at least 2 inches. Once you complete 30 chest compressions, use the head tilt chin lift method to open the airway. With the airway open, pinch the victim's nose with the hand that's on the forehead. Deliver 2 rescue breaths that make the chest rise, fall, fall. Then repeat. 30 chest compressions, 2 breaths. Continue 30 chest compressions and 2 breaths until help arrives, the victim shows signs of life, or an AED arrives on the scene.